emeritus, Sloan Kettering, Dr. DeHarven. Here's what he says on the HIV isolation, the very issue that Janine Roberts is saying. Quote, I have never observed one single particle of retrovirus in any of the thousands of samples of human leukemic, cancerous, and AIDS-related samples. I studied under the electron microscope for more than 40 years. In my judgment, the very existence of the so-called HIV has never been scientifically demonstrated. We all harbor in our genome sequences of endogenous retroviruses that do not have any known pathogenicity and therefore should not, under any circumstances, be called HIV, since that name implies pathology. HIV has been fraudulently invented for the monumental financial profit of the pharmaceutical industry. Highly toxic anti-HIV drugs have been and still are responsible for the death of innumerable patients. Unquote. Quote, dominated by the media, by pressure groups, and by the interests of pharmaceutical companies, the AIDS establishment lost control with open-minded, peer-reviewed science. The unproven HIV equals AIDS hypothesis received 100% of the research funds, while all other hypotheses were ignored. Unquote. From Dr. Rosalyn Harrison, Fellow of the Royal College of Surgeons and the National Health Service from your country, quote, virus isolation is necessary to prove virus infection. Retroviruses have laid down a set of criteria to distinguish spurious from genuine retroviruses. HIV does not fulfill these criteria. And also one of the very first scientists around the world who came forward and said, hold on, you've got it wrong. And this is a woman who's asked multiple times to come to America to debate. No one has taken her up. And what I am also going to tell you is that every opportunity that we have had to debate the pro-HIV hypothesis people, they have rejected those debates. Even when I took a camera crew to Geneva, to World Congress on HIV, and in the public section where you're allowed to go up to a microphone and ask a question, they refused to answer our questions, dismissing us out of hand. And we took leading professors of our own question from anyone involving this. Here's what this great Dr. Papadopoulos Eliopoulos, she's a biophysicist, professor of medical physics, Royal Perth Hospital, University of Western Australia. Quote, there is no proof that HIV causes AIDS for many reasons, but most importantly because there is no proof that HIV exists. Let me repeat, there is no question of isolation. Gallo did not isolate a virus. There was no electron microscope pictures of a banded specimen that one would expect to show nothing but retroviral particles. The HIV antibody test did not detect a virus. The fact is that an antibody test, even if repeated and found positive 1,000 times, does not prove the presence of viral infection. Professor of Pathology, Professor of Medicine, University of British Columbia, Professor James Hudson. Quote, I stopped going to AIDS meetings several years ago. I could no longer stand the stress of restraining myself from getting up and shouting rubbish. None of these investigators isolated actual viruses or viral genomes. All they do is add some primers to a PCR mixture and pretend that the printout represents HIV genomes. None of this has been proven, and furthermore, the PCR technique was never conceived as a quantitative measure of anything. In view of this, we should always qualify our usage of the term viral load. Otherwise, we fall into the trap of subscribing to their hypothetical nonsense. I do not believe there is an AIDS epidemic in Africa or Asia. People there are still dying from the combined effects of chronic infectious diseases, plus malnutrition, poverty, and other factors, just as they always have. One more. And this is from the co-founder of the HIV virus, the virologist, Pasteur Institute, Dr. Luc Montagnier. Quote, AIDS does not inevitably lead to death, especially if you suppress the cofactors that support the disease. It is very important to tell this to people who are infected. I think we should put the same weight now on the cofactors as we do on HIV. Psychological factors are critical in supporting immune function. If you suppress this psychological support by telling someone he's condemned to death, your words alone will condemn him. We did not purify, isolate the virus. We saw some particles, but they did not have the morphology, meaning shape, typical of retroviruses. They were very different. What we did not have, as I have always recognized, is that it was truly the cause of AIDS. Now mind you, the co-founder didn't isolate it. Why then have we gone on this way? One other personal observation before I go over to Manette Loudon, who will be reading this. We have more than 2,000 outstanding scientists, Nobel Prize winners, professor emerituses in virology, molecular biology, public health, who all are so outraged that they're willing to go on the record and risk their reputations. I believe that says something. They want a debate. They want to have testimony. And yet, no one has invited them to do so. So we are presenting some of their views now. But all 2,000 of their views are on my website, their credentials, their background, and their statements. For the average person who is easily misled, for the average legislator, also equally misled, understand this about AIDS in Africa. And please share this if anyone knows him with Bill Gates or Bill Clinton, because their efforts could help so much to correct what is wrong in Africa and save lives. Through their foundations and their pharmaceutical company contacts, giving expensive drugs is not the answer. Let's just use one example. Let's use South Africa, the largest country there. You have the largest identified number of people suffering from HIV infection and AIDS in Africa. You have a large African group of industrialists, multinationalists, financiers. They have no AIDS. You have, living in that same area, the mercantile groups, people who own their own businesses, successful business people, no AIDS. You have a large bureaucracy, school teachers, police officers, firefighters, medics, bureaucrats, no AIDS. You have a large professional class, doctors, engineers, professors, accountants, no AIDS. And then you have a field that's about a mile wide, mile and a half. And there you have one of the largest ghettos in Africa. And there you have an epidemic of AIDS. Now just use common sense, no science. How smart would this virus be that it would skip over you if you're an industrialist, a banker, a police officer, or a professor, and infect you only if you live in this ghetto? And that is what AIDS is in Africa, massive poverty.
Could I add something there, Gary?
Because this is the difference. Show me the people in our AIDS establishment. Show me the people making the $1 million, $100 million grants. Show me the people looking for vaccines who have gone to Africa, spent time there, lived there, researched there, as my guest, Janine Roberts, has done. Tell us your personal experience.
I went out to South Africa just over a year ago to do the research